I think from a public health perspective, of course, what we want to see is that the people first in line to get the vaccine are those who are at greatest risk of infection and at greatest risk of becoming severely ill. And this is true both within countries and across countries. So what we would want to see is a set of arrangements where we have, for example, health workers, those who are older, those who have underlying health conditions in all countries able to get access to a vaccine first. Unfortunately, what we have been seeing over the last few months is in fact more of a rule of the jungle type of situation where we have the countries that have the greatest resources, primarily in Europe, in North America, Japan, for example. It's those countries who have managed to get a much, much larger volume of vaccines secured than the rest of the world.
Do you have a view on the WHO's COVAX facility and how useful that's going to be for the overall rollout, especially to those lower income countries that Juliana was referring to?
Indeed. So the COVAX facility is a real ray of sunshine, I should say, in what has been a pretty dark situation in terms of global vaccine access, because you have almost every single country in the world has agreed to collaborate under the umbrella of the World Health Organization and two co-leading organizations, Gavi and CEPI, as they're known. So you've had every single country practically agreeing to cooperate to basically share vaccine supply. One of the big problems, though, is that many countries are not only relying on COVAX. So as I mentioned, the wealthier countries are betting on more than one horse. They're getting their own vaccine supply through bilateral channels, through direct agreements with companies. And they're also saying we will support COVAX. And what that means at the end of the day is that although there's a lot of good intention and now a significant amount of money in this facility, in the COVAX facility, there actually isn't a very large volume of supply that's available. And so right now, we don't expect that more than, let's say, maximum 10 or 15% of the population in developing countries might be able to access vaccines through COVAX. But one thing that has not been very, very widely understood is that a number of developing countries, particularly middle-income countries that are participating in clinical trials, or those countries that have access to manufacturing capacity, many developing countries are actually also striking their own bilateral deals. They're not just sitting back and waiting for somebody to hand them, a basket of vaccines.
And if we just look at the scenario where we do get a vaccine in various countries, the next part of that question, the next part of the equation is take-up of the vaccine. How many people are actually willing to be vaccinated? And we know that there's widespread skepticism around vaccines generally, but also specifically around the COVID vaccines, given the speed with which the development process has taken place. Do you think that higher efficacy could increase uptake of a vaccine? If people hear that vaccines are 90+% effective, are they more likely to take the inoculation?
Yeah, I do think the technical characteristics of any vaccine do matter a lot. So that would include efficacy, but also safety. So if you believe that the vaccine can both protect you effectively and also that you're very unlikely to develop any kind of side effects, then I do think that we've seen in previous research on vaccines that the specific characteristics of a vaccine, they really do matter. But it's not the only thing that matters. We also know that some parts of the population will have a deep-seated hesitancy or skepticism towards vaccines, no matter what. We know that trust in government, trust in public health authorities also matters quite a lot in terms of building that willingness to come forward and be immunized. Unfortunately, it is true that we have seen quite a lot of vaccine hesitancy around the world, and that in some countries it's of course much worse than in others. So it's very difficult to say at this point. When we have very, very little information on the final safety and efficacy data of any of the vaccines, it's very difficult to say finally how many people will in fact come forward and agree to be immunized.